Good morning. I'd like to call the August 11th, 2014 Human Services Committee meeting to order. I am looking for an approval of the agenda. We have a motion and support. Are there any corrections, additions, deletions? All in favor say aye. Aye. Opposed? Passed. Please note, Commissioner Leitner is not here. She is serving the youth within our community out of the country currently. At this point in the agenda, we have public comment. Is there any public comment? Seeing none, we'll move on to the meeting minutes of July 14th, 2014, which are attached in your board docs packet. We have a motion and support to accept the minutes as printed. Any corrections or deletions, additions? Seeing none, all in favor say aye. Aye. Opposed? Motion passed. Next on the agenda, we have Lifeways. Mary Beth?
Good morning, Commissioners.
Good morning.
So this is my monthly report for what's happening at Lifeways. First thing related to counties, I wanted to let you know that we're still having discussions with the county about extending some of the facility supports that they provide related to safety management, and hoping that we might be able to negotiate some additional services with the county related to support for Lifeways in that area. So we're currently having those discussions, but are not at a point where we're finalizing anything at this point. But wanted you to be aware of that. Did you have a question?
I was just going to say, could you elaborate a little bit on that safety, what you're talking about? So that
it's things like fire drills that are required and tornado warning drills within the building and responses for when individuals might fall, those types of safety types of things within our facilities. Right, safety, and that's exactly what it is. But some of the functions, I think we're at a point where we're trying to negotiate what that might be, is some of the things the county is not necessarily experienced with because some of our accreditation requirements. So kind of looking at could some of those functions still remain in-house, but what functions could we negotiate with the county for support? So that's what that's related to. So thank you. The other item that I wanted to point out is that we're very hopeful that we will have a closing with the building for the for-profit section of the building, hopefully by the end of this month. Update related to where we are with general fund. Good news is that Healthy Michigan enrollment is going very well. It's actually, the projections are farther for enrollment than what the state had anticipated. Initial projections were that we would be at about 250,000 eligibles in the state of Michigan being enrolled, and they're at about 320,000. So we're beyond what the initial projections are. For Lifeways, that's a good thing because that with the general fund cuts that we receive, this offsets that by enrolling them with Healthy Michigan. The other benefit that we see from a behavioral health perspective in serving those individuals is that now they have a benefit they never had before, because while they came to us and they would qualify and we would use general fund dollars to serve them, that did not mean that their physical health needs were being met. So this allows individuals to also have health benefits that they did not have in the past. So we are doing everything we can as an organization to continue to increase those numbers. And I was hoping to have the numbers before I presented today, because the numbers in your report are actually from last week, but we're at 80% for countywide for Jackson County as it relates to what they projected for Healthy Michigan, and I anticipate that that's probably gone up some since that reporting period. The other thing that I wanted to report on was related to Mid-State Health Network and where are things related to that. The big thing is currently the Mid-State Health Network. As you may know, in the past, the county commission makes an appointment to the Substance Abuse Advisory Council. Now that's going to be part of Mid-State Health Network, and we're seeking that appointment. And I understand after speaking with you, Julie, that'll happen in July. Or August. It's August.
Correct. What we're looking at doing in order to meet your deadline then is having a special meeting at the Board of Commission meeting, which is Tuesday, August 26th.
Okay.
Is
All
to
right.
help you out meet that deadline.
All right, I appreciate that. And that's an appointment to serve on, and a key function of that is to be a part of proposals that'll be reviewed at the Mid-State Health Network, because now we're a part of a 21-county, 12-community mental health, to look at proposals for the funding that comes through the PA dollars, to be able to approve how the counties want to utilize those dollars for prevention-type substance abuse services in their counties. What's important to note is that those are county dollars, so it's not a matter of them saying, no, we're not going to allow you to have those dollars. They are the county's dollars, but it's a matter of reviewing their plans and then saying, maybe they may make recommendations for adjustments to the plan, but it's really, those dollars are the county's dollars. So I want people to hear that, as it's part of that Mid-State Advisory Council.
Madam Chair, the dollars is the dollars that we used to pass through, Mike, to Lifeways, to Mid-South Substance Abuse Commission, and the county was able to keep half the dollars, and we would forward the other half for substance abuse services. And that's the dollars that now she's talking about.
Goes.
And the importance of that appointment is to make sure that as many of those dollars as possible is spent, is spent inside the county. But one of the other things, when you, maybe I shouldn't be talking, a part of a big network is that sometimes if another county is short and you're not spending your dollars, then you can move dollars over. Or at the same time, if we spend more dollars, we might be able to shift dollars from another area into the county. But the importance is to make sure that we have all of the entities set up to request those dollars so that we can spend all the dollars that belong to Jackson County.
Right. Right. Thank you for that additional clarification, Gail. The other thing that I wanted to mention is that part of, as we regionalize the community mental health, they're also planning on regionalizing the coordinating agency functions, which is the substance abuse management within the state. Currently, there are 5 coordinating agencies for substance abuse within our Mid-State Health Network. We will be, over the course of the next few years, consolidating that down to 1, but right now, Mid-State Health Network has received 3 proposals, and due to the fact that it is a significant size that we're covering, we're one of the largest in the state as far as county coverage of counties, that Mid-State Health Network is looking at accepting all 3 proposals as we transition to just 1. So going from 5 to 3, and then ultimately to 1 coordinating agency for the region. The other thing that I'd like to point out that's happening at Lifeways that's critical for our community, and I think I mentioned it briefly last month, but we are at the point now we are hiring for these positions, is related to some diversion services, inpatient diversion. We are implementing an intensive crisis stabilization service, which is a service that is mobile. And by that I mean when an individual is in crisis and you're able to divert them from going into inpatient, this mobile team would go to wherever that person's at and provide intensive services to stabilize and prevent hospitalization. It's going to be a great asset to our communities that we've not had. We're looking at how we might partner with the jail and with the law enforcement within both counties to be able to meet their need as well and not have people be taken to the ER. So I just wanted, as we know more and as that we start rolling out that program, we will continue to keep the county informed as to that progress. But that is it for my report today. I don't know if there are other questions that anybody might have.
Mike?
I just had a question in regard to the hardship request that the county
Yes.
made. Have you heard anything from Mr. Reddenwick or otherwise?
I have not. I haven't even heard, I didn't get a copy. Did you submit a hardship request then? Because I've not heard anything.
We did.
Okay.
Along with Hillsdale, I'm told.
Okay. I know that you were both jointly looking at doing that, and I have not heard anything at this point in time. I appreciate you informing me of that, though.
Okay, thank you.
Thank you. What other comments or questions might you have for Mary Beth? Thank you for that information.
All right, thank you.
Thank you. On the agenda next, we have the RSVP Annual Report. I don't see anyone here. Is there anyone here that would like to add anything to the report that's submitted on Board Docs? Again, it's a review from January to June of 2014. Some important information there. Any comments or questions regarding that? Commissioner Rice?
I'd just like to say that being on that council, if you have looked at the report, you'll see it's very thorough, and you'll see the significance. And obviously, everybody knows I've been on RSVP since I've been a commissioner, and obviously I feel strongly about this, the work that they do. And I would even say that Marcy over there understands RSVP and the significance that they are for our seniors and our veterans. And again, to me, this is a service that's definitely needed, and it's certainly not duplicated by JATA or anybody else. So again, from my perspective, it's very good that we have them available in our county.
Thank you. Moving on in the agenda, Department on Aging Monthly Report. Marcy?
Good morning.
Good morning.
The first thing I included in my report is a group called the Friends of Jackson Seniors, and they're a nonprofit entity that the Department on Aging staff works with. And their mission is to support senior services, and they plan to have their first fundraising event, and the purpose is to support the Meals on Wheels program. Because Meals on Wheels is a very visible program. A lot of people know, when you hear the term Meals on Wheels, you know what that means. It's nutritious meals delivered to older adults who are homebound. And there's not a fee charged for the service, it's by donation. So the event's going to be called Soups On for Seniors. It'll be held in March, and more information will be forthcoming. But the first step is to develop a website, and the Friends of Jackson Senior Boards is paying a consultant to develop that website, but the Department on Aging staff will be helping the consultant as far as what information to use in the website. So I just wanted to let you know that's one of the things that our staff are working on. Our Deputy Director, Carol Lorenz, she's been with us 3.5 years, and she is taking a position at Region 2 Area Agency on Aging. It's closer to home, and a couple other better things for her as far as the job goes, and it ties in with her previous employment. So we were glad to have Carol with us for that amount of time and wish her well in her new position. My Choice Medicaid Waiver, there's a program called Community Living Supports. So when an older adult becomes eligible for Medicaid waiver, that means that their situation is such where they need services in their home, or they could be eligible to live in a nursing home as far as their level of care. And there's income requirements, and when you're part of Medicaid waiver, the waiver program is able to pay for more services in the home. And this started back in 1998, and we worked closely with the Area Agency on Aging so that people who were currently receiving grant services, if they were eligible for Medicaid waivers in-home services, we encouraged them to apply and become Medicaid waiver clients. And that has been happening then for the past 15 years. And might have been 3 years ago, Medicaid waiver changed the way they define in-home services, and they call it community living supports. And at that time, I thought this might be adding more requirements to what we need to do, and of course we'll follow those, but I've been watching it to see when it would cost us more than what they're reimbursing. So we are one of several service providers. So there's Great Lakes, Allegiance, Home Instead, Elder Care. There's quite a few options in the community. So the Area Agency on Aging support staff can contact other home care agencies that they have agreements with and have a worker assigned. So the people that we're serving currently will continue to serve, but we're going to be telling the Area Agency on Aging we're not going to be adding any more people. We're going to start to phase out. But again, we're not the only option available. They have other options in the community. Because the Medicaid waiver has been a source of revenue for the department and has supported in-home services, but as I mentioned, it's gotten to it was level for a while as far as covering our cost, and the agreement that is coming up starting October 1st, it's adding some other requirements that's kind of tipping the scale, and it's not going to work for us as a source of revenue. So I just wanted you to be aware of that. And as I've mentioned before, senior millage and grants focus on providing services for older adults who don't qualify for Medicaid waiver, and yet they can't afford to hire help privately in their homes. So that's what we focus on as far as our in-home services. Meals on Wheels will remain the same. We'll continue to provide those to Medicaid waiver clients, and then we're able to bill for each meal to the Medicaid waiver program. We had our annual grant and Medicaid waiver, including fiscal assessments. They're not a CPA audit, but every year someone from the Area Agency on Aging comes and looks at all our bookkeeping records, how we keep track of what expenses are billed to what grant, what documentation we have. For home care, for example, for our home care workers, they have timesheets that document what services they provided. Were they personal care, homemaker, respite? Was it Medicaid waiver or was it grant funded? Of course, Medicaid waiver will be phasing out. So they do look at our records and how we track our time splits, how we document with meals, depending on, in the kitchen staff-wise, depending on the number of congregate meals for our senior sites and Meals on Wheels, that percentage meal split decides how the kitchen staff time is split. Time is billed to each grant. If 16% of the meals prepared are congregate, then 16% of their time is billed to congregate. So it was mentioned Friday on the single audit about our documenting our time splits, and we do that. This is just an example I brought, and it shows how time is split between the budgets. We have a couple people that keep track of their hours because they're within one budget, but within that one budget for the county, there are 2 grants, so they document how much time they split between Medicare, Medicaid assistance, and their other work. We've been doing it based on a percentage. Is half your time spent working on this program? Talking with Jim Latham, we're thinking, well, if we change it to hours, that might be more in what the auditor is expecting us how to document. So we're looking at I'll be changing that form, and I'm hopeful that when the new finance software is installed that we might have an even better way to electronically track this. Right now we're doing it on paper. We're having a community event September 15th, and attached to your report is a flyer about the Classic Car Festival. And it's a festival for us in the community to get the word out about the Department on Aging. The staff that are planning this are making it intergenerational. They want to have fun things for people of all ages to do. So one of the things happening are we're inviting people who own classic cars to please come and park your car. I have learned this to say this is not a classic car show. When there's a classic car show, there's judging and prizes, and we're not doing that. We're having a festival, and part of it is classic cars, so people can come and look at those. So if you can make it, we're having it late afternoon, early evening, hoping that people can come by on their way after work, that type of thing. Any questions about my general report?
Comments or questions for Marcy? Commissioner Mahoney?
Thank you. I would just like to say, Marcy, that most recently, you know that my sister has started receiving Meals on Wheels, and the person that came out was so nice. She noticed that I had another sister in the home that may be able to benefit from the Meals on Wheels, and they just really included her, and we really had a nice meeting when they came, and I really appreciated them and the services that they provide. And if they can't get in, they're happy to call you and say, hey, I'm at the door. It's just been a really good experience. So thank you very much.
Thank you for saying that, and I'll pass it along. I work with some really great people. So I do a good job.
Makes your job easier, doesn't it,
Yes.
when they make you look good like that? Thank you for sharing that. Next on the agenda, we have the Department on Aging Senior Nutrition Primary Food Vendor Selection. The information is included in your board docs packet. We're looking for an approval of Gordon Food Service as the primary vendor for the Department on Aging Senior Nutrition Food and Supply Products, and Prairie Farms for the milk for a 3-year contract. We have a motion to approve and support. Any questions or comments for Marcy? Marcy, is there anything you'd like to add before we take the vote?
I'll just comment that, in case you didn't know, Behrman Milk joined Prairie Farms, so they're together now. And we did look closely at the prices and looked at different menus, and also their software for nutrition analysis. And our preference is to continue with Gordon Food Service for the next 3 years, and then for milk, Prairie Farms, because they are a lower cost.
Excellent. Local, and that is on I-94 at Mount Hope, isn't it? Where they're out of, I believe. So,
think so.
Close by as well. So we have a motion and support. All in favor, say aye. Aye. Opposed? All right, there we go. Thank you,
Okay,
Marcy.
thank you.
Next on the agenda, we have the Health Department monthly report. Richard?
Good morning, Commissioners. Have a pretty lengthy report that I put into the board doc system for you. I'll try to just highlight some of the key items that I have on my copy here and give you a little bit more information. On the first page, under Public Health Service Integration, I'm describing what we're doing with trying to integrate with the healthcare system in testing and referral of children for lead exposure. And while I guess I might describe it a little bit as sometimes it's 2 steps forward and 1 back, but what we're finding as a result of working with the health system and the Jackson Health Network is that it's actually creating opportunities for us to improve the way we're doing things in the health department, because it's identifying gaps and issues that we need to resolve, and then I think at the end of the day, we're going to end up with a better approach and a better service delivery than what we currently have. But so we're kind of back a little bit in internal focus in the health department on that particular service right now, developing our protocol and eliminating some gaps that we saw in that as a result of having our internal meeting. So we will get back with the network as soon as we can. We're also doing a lot of work with the provider survey on behavioral health diagnoses here in Jackson County. This is something that we identified as a result of doing the assessment of the burden of mental illness in Jackson County among adults, and now we're moving forward. This is one of the recommendations and next steps, and it's really critical, really excited about this because I think it really represents what we need to do in the community to determine how best to use our primary care provider resources, and then what do we have to actually put in place to make sure that people get to the right provider when they need to get to the right provider. So it's really about determining provider training and comfort and identifying and managing behavioral health diagnoses and access to mental health treatment in the community. And we're also planning to do other surveys as well. We need to survey the psychiatrists, and we also will need to survey the other mental health providers in the community, because we've got to get to the root of the capacity issue. So that's what we're doing with that one. I was scanning through my report and I realized, wow, we had a lot of activity in the past 30 days related to grants. And I've got, I think, 6 or 7 of them listed here, and I probably missed one somewhere along the line. Well, I think while we're disappointed that we couldn't proceed forward with the lead poisoning prevention CDC federal grant because we weren't eligible due to population size, we're glad that the state is pursuing it, and I think the state is very much aware of our interest in doing more with that here in Jackson County. We could actually link a lot of the things that we've talked about in public health service integration with lead testing and referral of children as component pieces of this grant. So I'm hoping they will get the grant number 1 and then reach back out to us to see how we might work with them going forward. Some other grants that are kind of scattered throughout my report, but I'll just quickly touch on them. Prenatal Task Force received a small grant of $5,050, I think, for sleep sacks, and we're really pleased to see that. We were also awarded $10,000 each for the Safetyville and the Reducing Underage Distracted Driving grants through the Traffic Research Council, if you will, the Safety Council. The hospital received a birthing hospital mini grant of $10,000 for planning, and the purpose of that grant really is to do what we've already been trying to do with health integration, and that's to set up referrals from the hospital for each newborn mom and infant, if you will, to see if they're eligible for the maternal and infant health program and children's special health care services programs that we provide at the health department. So perfect timing and opportunity. So the hospital did get that grant, and they will be able now to apply for a $10,000 implementation grant later this fall. So we worked with them to help develop that grant. Teen Pregnancy Prevention Initiative received $5,000 in United Way discretionary funds to help redo some older videos that we use with teens. And while we had initially applied for $10,000 because we wanted to do two, we'll probably only be able to do one, but we're grateful for the funds that we received. And also the Car Seat Safety Program received $10,000 in funding again from the Safety Council for the next fiscal year. So we'll be able to continue to provide the car seat safety program in the community. We are looking internally also at some new hours of operation for the STD clinic. We've had some turnover in staff on the administrative clerk side, and this has also resulted in our ability to look more internally at that particular clinic to see if we're really running it at the hours that are most convenient and flexible for the public serve. So right now you can see the hours that are listed there from Monday through Thursday, 9 to 4, close over lunch, and Fridays 9 to 1. We are in the process of recruiting for a second part-time RN position that became vacant, and when that happens, we intend to open it up even more so that the hours at least run from Monday through Friday, 9 to 4. So we're hoping that we can do that as soon as possible. Commissioner Polachek had a question last time about our pertussis rate in the community, and we did identify that information for you. We definitely did have an increase in pertussis cases so far in 2014 compared to 11 and certainly 12 and 13. So we know that there's a lot going on out there. As I've described in the discussion about this particular item, while the vaccine is pretty effective, if you will, we see waning immunity take place even amongst people who've been vaccinated, and 15 to 20% of people will not actually achieve an immune level as a result of getting vaccinated. So we always have kind of an unprotected, potentially exposed population in the community. So this particular vaccine will never be 100% effective in preventing outbreaks, but it's the best tool that we have in the box, and we're going to keep using it. I think what we can do is continue to encourage more people in the community to get vaccinated, because everything we do to increase herd immunity will reduce the number of persons that are susceptible. So we'll keep working on that. Not sure if anybody had any questions about the National Immunization Survey of Teens. I've kind of talked a little bit about that in my report on page 4. We do better overall in teens than many of the other counties in the state, and in some areas better than the state overall. So we're pleased with that, but we still have other vaccines that we want to see a lot more uptake take place on. So we keep working with partners on that. Ebola virus disease has certainly been in the news lately over the past 2 to 3 weeks, and I want to give you a little bit of an update on what that looks like from an international perspective. The CDC has elevated themselves into a level 1 alert status, if you will, and it's primarily because of what it's doing in West Africa, spreading now to a 4th country over there, Nigeria. And the concern is that when they ramp up to level 1 alert is to make sure that they can do everything, working with international partners to help control the outbreak in foreign countries overseas, so that lessens our risk here. And we've received a lot of information from the state and the CDC on how to evaluate these cases. It's not something that public health is going to be doing, but it has been shared with all the providers in the hospital and the community as well. And also infection control guidelines have also been issued. Particularly difficult virus to be dealing with, and I think it's going to be with us for a long time. If you have any questions about unaccompanied alien children, I'd be happy to answer them. These are all the children coming across the border, primarily in the state of Texas. Down at the bottom, really, I think our role in public health here at the local level is if there's a case of communicable disease that needs attention and it gets reported to us, we would follow up with that like we do for any other communicable disease investigation. And also maybe interaction with us for immunizations that might be needed. So the Vaccine for Children vaccine that's provided by the state and federal government, they're eligible to receive that vaccine through the health department. A lot has gone on with the Healthy Michigan Plan. I've got a pretty lengthy update in there, including a statement from Director Jim Haveman in terms of reaching the number of first-year goal of 322,000 enrollees, if you will. And he had some examples I've shared with you on an individual basis. We're continuing to work with partners in the community to participate in enrollment events that are scheduled in the community, and there was a couple of those that were held in July. And then we also participated in a meeting with the Sheriff's Department concerning the possibility of jail inmates who might be eligible to be enrolled in the Healthy Michigan Plan to help them figure out how they might do that. So it could save us a lot of money at the local level. See if there's anything else we have here. There's some updates on our Breastfeeding Coalition. We're doing a fundraiser through the Health Department this particular week. The WIC program had a nice Project Fresh event that was held on August 6th. We had 3, I believe, farmers there with fresh fruits and vegetables. It was a really nice event, and of course it was pretty much even open to the public, but a lot of people from the Human Services building and the northern portion of the buildings up there on the county side did participate as well. I think that's about it. If you had any questions on anything more specific, I'd be happy to answer them.
What questions or comments might you have for Richard? Richard, one area that was covered extensively prior to your arriving in Jackson County were the fees set at the STD clinic. And specifically the in-county versus out-county and
Right.
the fee schedules. That was an extensive conversation that took place. I had been checking in with Mary when she was still a county employee every so often with those numbers, and at some point in time, it'd be interesting to see, to have some data on that in regards to where our numbers stand of in-county versus out-county and the revenue that's been generated, if any.
Okay.
So,
Be happy to do that.
follow up. Right. Anything else, commissioners? All right. Thank you, Richard. Keep
Thank
up
you.
the good work.
Thank you.
Next on the agenda, medical care facility financials. We have the June 30th, 2014 financial statement from the medical care facility. I don't see anyone here. Does anyone have any comments or questions regarding that? Next on the agenda, the claims from July. We have a motion and support to pay the July 2014 claims. All in favor, say aye. Aye. Opposed? Motion passed. There are no other meeting minutes. September reporting schedule will be announced in September. How about that? In regard to reporting schedule, just for the public's benefit as well as the Board of Commissioners and administrative staff, I'd like to remind everyone that the schedule has been modified for August and September. We're not following our exact routine in that there's an additional week in between Standing Committee and Board of Commission meeting. So in August, the meeting will take place on Tuesday, August 26th at 7 p.m. And in September, that will take place on Tuesday, September 23rd. Those were announced several months ago. I believe the September meeting was even announced at the beginning of the year. So, but for those of you that need to get your calendars current, those would be the dates we'd be working with. That takes us to public comment. Is there any public comment this morning? Seeing none, is there any committee member comments or commissioner comments? Seeing none, we'll adjourn to the call of the chair.